Welcome, everyone. Good morning, good afternoon, wherever you are. Today, before I switch slides here, today we are talking about NextGen virtual visits. And this is one of our many webinar series that we'll be having and hosting for you all. Happy to do a deep dive today. We did basics yesterday, so if you didn't have a chance to join us, there are many more offerings of that coming. But today is our deep dive. I have Kevin Byram with me today from our sales solutions specialist team. He'll be doing some of the deeper content into the demo, but let's jump into what we're talking about today. So a little bit about us, who you've got here, and we'll have other folks that'll be supporting these conversations as well. So you'll see some new faces, or some other faces, if you will. On our agenda today, we want to really highlight some of our integrated solutions that integrate with virtual visits. So you've heard of our patient experience platform. We have a multitude of solutions within that platform. Virtual visits is one of those that supports the visit of the patient journey. We can also support patients self-scheduling virtual visits, and you'll see that today, as well as integration with our partner, Instant Medical History. Instant Medical History really allows you to model in-office workflows. You can collect clinical data from the patient intake and push that data into discrete fields. So you'll see some examples of that today as well. We also want to share some of our enhanced features that really support other workflows within the virtual visit. One, interpretive services. We have provider on-demand scheduling. This allows for someone within the practice to schedule an integrated virtual visit through the virtual visit platform. So Kevin will walk you through that as well. And then a new feature that really just supports overall workflow for providers is a picture-in-picture feature that's been rolled out. So we talk about the patient experience platform. Where does NextGen virtual visits fit into the entirety of the patient solution and within our platform? I'd like to call this out because we've had acquisitions, we've had a lot of new branding, and that can be a little bit confusing. So when we talk about PXP, or the patient experience platform, that is a multitude of solutions that support the patient journey. So we're going to talk about visit management, patient self-scheduling specifically into a virtual visit. And then we're also going to share that instant medical history workflow with you. So supporting visit management, pre-visit, and then our visit with virtual visits. So just a little background, if virtual visits is fairly new to you, we are a fully compliant login-less solution that is fully integrated into NextGen practice management and EHR, as well as a multitude of other solutions that we'll share with you today. This really supports ease and convenience for patients. With that login-less workflow, it really allows patients to have access to their providers in a really easy, seamless way on their device, potentially from anywhere. So that's really nice. No username, no password to log in, simple click of a link to join that virtual visit. We always like to share our patient satisfaction scores. We have done over 2.7 million virtual visits since the end of March. And with that, we still have a very high patient satisfaction score, 9.1 out of 10. So lots of positive feedback and lots of positive experience from our patients and our practices alike. So without further ado, so we can get into all the fun content, I'm going to hand privileges over to my colleague, Kevin, and we're going to jump into a live demonstration of that those features I just shared with you. Thanks, Kevin.
Awesome. Thanks, Lisa. Well, welcome, everyone. I'll be walking you through the demo today. Please feel free to direct any questions that you may have while I'm walking through the demo into the Q&A. We also will be monitoring the chat window as well. And we'll try to answer those throughout, but we'll also take some time at the end of the call to make sure that we go back and address any questions that aren't able to be answered. Like Lisa just mentioned, I'll be walking you through some of the more ancillary solutions around the virtual visit platform that can really help your workflows. The first one we're going to start off with is the patient self-scheduling process. Patient self-scheduling is a really great way to reduce overall call volume at your practice. We see on average it reduces the overall call volume at practices by around 20%, 19 to be exact. which can mean hours and hours back to your staff members every single week and month that they would have previously been spent being glued to the phone. We also see that it helps drastically reduce overall no-show rates by allowing patients to properly cancel or reschedule their appointments rather than having to still rely on just calling the practice and speaking with the staff member in order to do that. We've also found that it can help attract new patients to the practice as well as fill gaps in provider schedules. This solution can be launched by your patients directly from the website by just placing a link on there. You can market this link however you would like, whether you want it to be a tab at the top of the page like you just saw here, or maybe like a big giant banner saying 24/7 online self-scheduling, so that patients know that they have this available to them. Patients who are accessing this via the website or just the link and not inside of the portal, they will have to go through a login process. The practice can either elect to do a username or password workflow, or like Lisa mentioned, a loginless workflow as well, where instead of having the patient set up a username or password, which sometimes creates a barrier of entry, instead we're just going to have them enter in their basic demographic information so that we can do a real-time patient search throughout the patient's database, looking for these key pieces of demographic information, and once again matching that with the patient's chart in the EHR and PM system. At a bare minimum, we need to collect first name, last name, date of birth, and the sex assigned at birth. But we do recommend also asking for their email address or preferred phone number or zip code. Once they enter in this workflow here, agree to your practice's privacy policy, acknowledge that they're not a robot, and then we're going to do a real-time pull from the EHR so that we can send an identity verification code to that patient, and I'm going to choose to receive mine via a text. That's going to be sent to the patient's mobile number on file, and they can just simply enter that code in. So while we're not making them actually create a username and password, it's still a completely secured and HIPAA-compliant login with that two-factor verification. Patients also have the ability to log in via the patient portal, where they would just be logged into. You see here the new PXP portal on Spring 21. And once they get logged in, they'll just be able to click on the schedule an appointment link, and it's going to launch them directly to the scheduling dashboard here. There's no extra login required when the patients are launching it directly from the portal. Now that we're in the scheduling dashboard, you can see that it's completely custom branded with your practice's logo and color scheme. It's optimized for both English and Spanish. The patient can see any upcoming appointments they have with the practice, as well as any past appointments they've had previously. Now here in the center of the page is where the workflow will begin to get highly configurable based on how you want to build out your practice's workflow. In this particular workflow, we're giving the patient the ability to choose their starting point, so they can either start with provider, location, or appointment type, whatever they prefer. However, if the practice would like, you could follow a more structured approach where you're forcing them to start with appointment type, or forcing them to start with location, or forcing them to start with provider, and then following whatever sequence works best for your practice. I'm going to start off with location just for demo purposes. It's going to import all of the locations that your practice is choosing to allow for patient self-scheduling. The patient can type in their zip code and get an idea of which locations are within a certain mile radius of that zip code. They can use Google Maps over here to get a bird's eye view of where these locations are located. And they also can get directions to that specific location by clicking this link. That's just going to launch them directly into Google Maps. So that way they can type in their address and get an idea of those directions. Once the location is chosen, it's then going to pull up the different appointment types that your practice has allowed to be scheduled online at that location. Each and every single location can have a completely custom event types that your practice is allowing for patient self-scheduling. We can do virtual visit event types. We can do in-office visits. We can do specialty appointments like orthopedics or BH and COVID-19 testing. So we can handle any and all appointment types that your practice would like to allow for online self-scheduling, but we do recommend starting off with a more handful of routine appointment types and then growing this out as your practice grows with the solution. And then when your patients gets more acclimated to patient self-scheduling, they're going to want to use it more and more and more and only want to call the practice when they absolutely have to. I'm going to show you a couple different workflows from here because when the patient chooses a particular event type, like virtual visits, for example, we have a couple different things that we can do in this scenario. The first is that we can just list out all of the event types that you want to make available for online self-scheduling within that specialty. So we can just see all of the virtual visit event types that I'm able to schedule with the practice at this location. We also have the ability to build out decision trees. And decision trees are going to allow the practice to, instead of just listing out all of the available event types, you're going to be able to ask the patient a series of questions, and that series of questions based on their answers is going to lead them to a specific event type. So if we look at the orthopedic workflow here, we're not going to list out a bunch of orthopedic visits. Instead, we're going to ask the patient if this is a new injury or not, and they can choose yes or no. If it is a new injury, well, we want to handle those new orthopedic injuries over the phone. So we have this pop-up message that is going to be presented to the patient that's letting them know that they need to call the practice in order to schedule this appointment. And then it will prevent them or stop them from scheduling with that workflow. However, if it is not a new injury, then it moves them on to the next qualifying question, which is going to ask them to specify their injury type. Is it spinal, shoulder, knee, hand and wrist, foot and ankle, or other? Well, it's a knee appointment. Well, now the solution knows exactly what type of event to schedule for this patient and only pulls up the providers who handle that specific type of appointment at that specific location. That's a pretty basic version of the decision tree, but you can see how you can build out those different questions so that you can ask them the same things that you would ask them as if they had called over the phone and make sure that you're leading them to the right event type. Just for demo purposes, I want to click on this consultation here, just so that you can see the different providers that it pulls up for the virtual visit event type rather than it did for the orthopedics. So it's going to be able to customize what providers this patient is able to schedule with based on the event type and the location that has been selected. We also can do things like forcing the patient to schedule with their primary care physician for certain types of appointments, or forcing them to schedule with a member of the PCP's care team if you're using care teams. When displaying the providers to the patient, we can display their name, their image, as well as their next available appointment. That might be very useful for the patient to know when scheduling a sick visit. Once the provider has been selected, it's going to do a real-time queue throughout the PM system looking for that provider's availability. It will cross-reference that availability with any rules or logic that practice has built out for this particular provider, for this particular event type, and for this particular location. Patient self-scheduling has a highly robust rules and logic engine that allows for over 500 different points of rules or logic to be built within it, so that once again, we can make sure that any appointment that's being scheduled and directly placed onto the practice's calendar or the provider's calendar is meant to be with that specific provider for that specific event type, for that specific location at that specific date and time. It gets really granular on the level of rules, and there's a lot of different options that you have there. So if you want to learn a little bit more about that, just reach out to your account executive and they can set up a call. But as far as the patient is concerned, all they're going to see is the available dates and times on the calendar for them to self-schedule into. So if I wanted, I can choose the 8th here at 11:15. And then we do have the option of to be able to collect insurance information from the patient. We can make this required or optional, and we can have the patient, do things like paying for themselves, or mentioning that they cannot find my insurance, or choosing the actual popular carriers that you guys do work with. Patient will just enter in the member ID and the group ID and the insurance phone number, and be able to submit that insurance information with their patient self-scheduled appointment. The final step is just taking them to a confirmation page and making sure everything is correct before scheduling this appointment. We can ask the patient a question on this page so we can collect any additional information that we may need to collect. And then once we click everything is correct, this appointment is going to be scheduled directly onto the provider's calendar inside of NextGen. The patient is given the option to add this to their calendar, and they also are sent a confirmation text and email for that for the virtual visit scheduled appointment. When the patient goes back to their list here, they can see that new upcoming appointment right here in their scheduling dashboard. And we typically would be able to cancel or reschedule this appointment, but since I have a rule built inside of my patient self-scheduling environment that states that a patient cannot cancel an appointment if it's within the next 24 hours, since this is within the next 24 hours, I'm not able to cancel it or reschedule it. But you can set those kind of custom rules so that once again, you can put those guardrails around patients being able to cancel appointments online. Once that appointment is scheduled, it is going to be dropped directly onto the provider's calendar into the PM system. So if we open up Dr. Fred Rosen's calendar and we go to The 8th, we can see that appointment for Kevin Byram. Sorry about that, everyone. Working from home, right? So as you can see here, this appointment was immediately scheduled onto the provider's calendar. We can see very easily that it was scheduled online with this PSS tag here. And then we also have the ability to see all the insurance information as well as the answer to the question that the patient was asked on that confirmation screen. We also can see that the appointment has been created by MedFusion, so that makes it super simple for the practice to be able to run reports letting us know, how many appointments have been scheduled over the last, 24 hours, week, month, quarter, year, so that you can get an idea of exactly how the solution is performing for your practice. But we do see on average that it reduces the call volume by around 19% for the practice, which once again could earn hours and hours back for your staff members. All right, now that's everything that I wanted to show you so far on patient self-scheduling. So now I'm going to switch over and show you the patient joining the virtual visit, but this time, instead of yesterday that we covered on the basic version, we're going to show you an appointment that has been scheduled with an IMH form. So that way we have the ability to have that data from the form flow directly back into NextGen via discrete data. This can help save your staff members tons of time and effort, that they previously would have spent, plugging that information in. So I scheduled an appointment earlier today for 1:15 for this virtual visit, nutrition visit for my test patient, Mary Williams. So that patient was sent their typical, text and email reminder for that virtual visit appointment. Once again, it'll be custom branded. It'll let the patient know that they have an upcoming appointment with this provider at this date and time. It'll allow the patient to test their device, and if you would like to, you can give them the ability to invite a guest. But really, all the patient has to do is just click this green button. It's going to launch them directly into their browser so they can begin scheduling, or so they can begin joining that virtual visit appointment. Now, in the basic version yesterday, we showed you the typical workflow of just a virtual visit intake form. This, once again, this questionnaire is being provided to us by Instant Medical History, who is a longtime partner of NextGen, and they specialize in the capturing of clinical intake data via a number of different ways that patients can collect forms. One being this virtual visit intake. We also can, if you're using IMH and choosing to add that to your practice, you also can have them sent directly to patients via text and email reminder if they're not doing a virtual visit appointment. You can also have these forms being completed inside of the PXP portal if you're on Spring 21, as well as it's going to soon be integrated with our Patient Engage solution. So a lot of different options there for you to use IMH forms and collect this information from your patients prior to them coming to the office and flowing back into NextGen via discrete data. So I'm going to begin filling out this IMH form. Once again, IMH has the ability to offer a large list of out-of-the-box forms that they can work with. And they also have the ability to do custom forms as well. So I'm just going through and answering all these questions with all of my measurements about taking my temperature, measured my blood pressure, my heart rate, pain levels, whether I've undergone menopause. Since my test patient here is Mary Williams and is a woman, if this was a man, it would not ask this question. And it also is able to read the patient's age. So you can see how it has the ability to, based off the different patient factors, ask them different questions. Okay. Now, this is just an example of one form that we're looking at, but once again, we can customize these out for you, where they have a long list of integrated forms that you can use that collects a wide variety of different information. And if you're interested in learning more about the forms that your practice might specifically use, once again, reach out to your AE. We do have the ability to set up calls and demos so that you can speak directly with the Instant team, or sorry, Instant Medical History team. Next, we're going to, you see how we can have the telehealth risk and benefits, consent to use telehealth. Once again, you can ask the patient to agree to your practice's privacy or telehealth policies, and we're also capturing that signature from the patient here. Now I'm going to have to turn off my video. Once I join the visit here, I'm going to be dropped in the waiting room for the providers so that they can join. The provider was going to be sent a text and email reminder letting them know that the patient, Mary Williams, has arrived in the virtual visit. The patient is going to go ahead and be checked in right here in the PM system. And then we'll also automatically create that encounter. So if I hop over into the EHR as the provider before joining this virtual visit, I see that the encounter has already been created. Patient has been checked in. All right, so just one more time, call out those pieces of integration that are going to help save your staff members a lot of time and effort instead of having to do that themselves. And since this one was scheduled with IMH, once the patient is actually checked in, that is when that data from that form is going to be imported into the patient's chart and placed directly into NextGen. So now when I go over here to open up my template that I'm going to be documenting my appointment with the patient, I can see that this information will automatically be directly pulled in. Oh, here we go. Lisa, help me out here. What am I doing wrong?
I think you're right down there at the vital signs. You got to intake open. Review of systems, just over to the right a little bit, Kevin. That's where that's going to populate. The rash.
Rather than having y'all all struggle through this, I'm going to go ahead in here and show you one that I just did earlier today. So you can see with this intake form, the instant medical history that I used, all that data from the vital signs was automatically imported there. So instead of having to do all of that plugging in myself, I just simply had to open up this particular intake form here that I'm going to be using to document with the patient. It also is going to attach a PDF copy of that form that has been completed. And then just to show you another one, here's one I did earlier, but with a PHQ-9 form instead of the medication review. So you can see here that when I click PHQ-9 and click calculate, all of the patient's answers are right there already in the templates. All I have to do now is hit calculate, and it calculates the score, and I can save and close for that for the PHQ-9 section. So you can see how simple and easy it is for your providers to now launch that appointment, have all that data already inside of the form or inside of NextGen, so that way they can just simply focus on conducting the appointment with the patient. I'm going to hop out of here and now sign in as the provider, show you a couple more additional features like Let me log in real quick. The picture-in-picture. If you want to learn a little bit more about how the provider is able to join the virtual visits, how the supporters are able to join the virtual visits and things like that, you can tune into our basics of the virtual visit webinar. We had one yesterday, but we will be having a number of them over the next 6 weeks. So feel free to register for that to learn a little bit more about the ins and outs, the basic pieces of the virtual visit solution. So with our patient here, Mary Williams, we're going to want to go ahead and join this visit, but we do have the ability to join a compact view. So that's one of our newer options here. So that way, when I join the visit, I can have the compact view right here at the top. I still have the ability to see my patient right there on the screen, but I also at the same time will have the ability to have my computer screen open and document at the same time while I'm on the video visit with my patient. If we're not using contact, so I'm going to leave this visit. We wanted to instead use the picture-to-picture. Then when I'm actually in the joined visit here, all I have to do is right-click on the patient and choose picture-in-picture. That's now going to switch me to the picture-in-picture here option to have the patient down here at the bottom of the page. And once again, I have the ability to be working directly inside of the EHR while conducting my virtual visit appointment. Awesome. Thanks, Lisa. From a demo standpoint for the patient, that's all I've got to show today. So I'm going to go ahead and end this visit. And the last thing that I want to cover here is the ability for your providers and support users to be able to schedule an appointment directly here from the Auto dashboard. So a certain use case for this would be maybe you're getting an after-hours phone call from a patient. You don't have your work laptop right there in front of you, and you need to be able to, on the fly, set up a virtual visit appointment. So I would click this blue plus button down in the right-hand corner. And the first thing I'm going to do is search for the actual patient. So just entering their first name, last name, and date of birth. Here we go. It'll do a real-time search throughout the PM system looking for that patient with that data. Pull up their patient's chart, make sure that you're confirming the correct patient here. Once we've got the patient, the correct patient selected, then once again, we'll just choose a visit type, right? And this is going to be able to pull all of the virtual visit event types that you've created during the implementation process. So you'll just grab the one that you need to conduct the appointment with. We can do a visit description. You'll enter in the date and time, and we can schedule that appointment right there on the fly. And it'll schedule it back into the EHR. So the reason why it had the red X for the EHR there is because there's an appointment scheduled at the time, and it's not meant to be able to schedule or double book for providers. But you can see here how if it was an after-hours phone call and you were doing this on the fly, you probably wouldn't have an appointment scheduled at that exact same time. So it would be able to schedule it directly back into the EHR. I'll let Lisa talk about this a little bit more as it's still, soon to become live, but we are releasing a group visits functionality, and we're currently testing out that functionality so that patients or so that practices can, conduct group visits in addition to one-on-one visits. So, Lisa, do you want to touch on that a bit?
Sure. Yeah, and actually, if you want to give me privileges, I've got a little sneak peek that I can kind of share with everybody. One thing I want to call out, and I'll do this at the end, I'll come back to it. But for those of you that haven't seen our marketing toolkit, there's a lot of really great resources here. Typically, if you've already used virtual visits in the past with us, you've seen this. But this is just a great toolkit and a lot of good tools and marketing materials for patients, explainer videos, all kinds of good stuff there. But let me hop over and show you some things that are coming soon. So this is exciting sneak peek that we've got. So I've got a little visual here for you. Group visits is in the works. It is in development and is coming soon. We have it live in stage. We're working through one other API route to go ahead and create those group encounters within EHR so you can access those specific templates. So this feature is specific to clients that are on NextGen Enterprise 5.9.1 and above. So just keep that in mind. Might be something that you'll have to think about after you take the upgrade. But 5.9.1 and above. This allows the practice management to enable group visit scheduling. And that's a key component, right? Because scheduling is going to be living within practice management. That's our source of truth. So once we turn this on, we're enabling group visits within practice management, and we create a specific virtual visit group event type. So just like any other event type, there's a lot of configuration that can go along with that, similar to the workflow that Kevin just showed you today. Maybe you have IMH questionnaires or intake workflows associated with that group type. You could also do our kind of virtual visit intake as well. You can determine consents and all those other pieces that come along with an event type. But those are some of the key call outs. Once you schedule that group visit within practice management with your established patient group, that will push a virtual visit link out to your patients. Each patient's link is still going to be unique. And so that's going to trigger those automated encounter creations, those automated status changes that occur, and all of those other integration points that you have for a visit. So what you see here is kind of a gallery view. This is how you're going to experience your group visit. The provider will be on the screen just like a patient in that gallery view with their name displayed. Patients have the ability to put in a nickname. So if they don't want their full name in that video, they can go ahead and put in a nickname, and that's what will be displayed. We also have a participant panel that allows the provider or the support user to have some features that they can turn on and off for the patient on behalf of the need for the group. So maybe they need to mute a patient. Maybe there's a situation where they would need to remove a patient from that group. They have the ability to do that there. Providers and support users will also have the same functionality within the visit. So they'll be able to chat with the patients, share screen, share documents, as well as, turn on and off their camera and microphone. They'll still have that in-visit timer. So really the experience is going to be exactly the same for the patients outside of their then now in a group visit. So that's really exciting, should be rolling out here by end of this month. So keep your eyes and ears open for those communications from our PXP team. There'll be a release in our chatter post, and I've got some resources that I'll share with you if you're not a part of that. So if that's something that is of interest, just let your account executive know, your account manager know. They can support that. It'll be similar to an enhanced feature that you would request, like interpretive services. You will put in a support case, let them know that you want to enable group visits, and they'll capture some specific information from you to go ahead and enable that functionality. So that is coming soon. Excited to share that. One of the other items that's on our roadmap that is coming after our group visit functionality is guest visit add. This will allow a provider user or a support user on the practice side to invite guests. You can invite a guest internally from your practice, maybe another provider or a resident student you want to bring in. External practice guests. So for example, maybe a referring provider or a therapist or someone from a different practice, and then on behalf of the guest as well. So you can see a few visuals here of what that looks like, and there will be notifications sent to that guest. They will have the ability to give a response. Are they going to be able to join that visit, accept or decline, and so forth. So you can see that example. There's also another component that's going to come along with that is a virtual waiting room. So if the provider user or the support user need to be with the patient first before they allow that guest to come in, they'll have the ability to do that as well. I see Kevin smiling because we've got Frodo here as one of our pictures. These are mock-ups, right? But you get the gist.
Sam,
so that's Sam. Oh, that is Sam. I should know that, Kevin. My goodness. Um, anyway, so you can see an example of what that virtual waiting room looks like. That they'll get a little, we'll be with you shortly, and then they can go ahead and admit or deny. Maybe the patient doesn't want to allow that guest into the visit. The provider will have some privileges over that as well. So that's a nice, fun, exciting sneak peek. With that is going to come a new experience for our users. So this is something that'll happen when we push that release. We want to make sure that our clients are aware of that. And there'll be many other communications coming out. But we're cleaning this up. We want to have less clicks for our users within the virtual visit solution. So you saw what Kevin showed you today when you log in. You see those big bands of the schedule and those visits. We are bringing that into a smaller column here on the left-hand side for upcoming and completed visits. You can see all of those visits like you could before, but you're also going to be able to see some of those other abilities that you could potentially resend communications. You can see that intake. You can see some of that information from the guest without having to click into those other menus and click out and so forth. So it's really just going to make it easier to utilize and see all the information in front of you, less clicks for your users, and a new user experience. So one is what you see here for the single visit. We've got the patient name, and then again, all that information here, less clicks, print, add, all of that fun stuff on one page. And then of course your 10 patients or your group visit experience as well. So that is coming soon. I'm going to give you some next steps and then we'll hop into a Q&A. So if you would like to see a demo of our virtual visit solution, if you'd like to see a demo of some of the enhancements that maybe you're unaware of, reach out to your account executive. They'll bring in the solution specialist to support those. If you want to add any of those enhanced features that you've seen today, for example, interpretive services, provider on demand scheduling, you can submit a support case for those enhanced features. Now, if you're interested in something like patient self-scheduling or instant medical history, again, reach out to your account executive. They can coordinate that demo and or discussion with you to bring on that solution as well. And just think, we're focusing on virtual visits today, right? But patient self-scheduling can be used for in-office visits. It's integrated with our portal and patients can access it through that capacity. Instant medical history is also a clinical data collection for portal, and another feature coming soon with our pre-check solution. So all of those new solutions kind of integrating together within the platform. If you are not subscribed to our chatter group, there is a virtual visit releases and update chatter group. I would encourage you to subscribe to that and be on the lookout for those new enhanced features that you saw today coming soon. If you missed session 1 or you want a refresher on the basics, we will be running this webinar series through May, about 6 weeks. Each week we'll have the basics and then follow up with a deep dive just like what you saw today. So send your folks here if you want to get them a refresher, if you'd like to get their eyes on some of the integrated solutions that we shared with you today. We will also share this recording out and have this information available to you as well. So with that, I'm going to stop sharing and we're going to hop into some Q&A here for you. So please feel free to use Q&A functionality. I'm going to go ahead and see what we've got going on here. I wanted to say thanks to Carol because she gave us some insight on EHR functionality, which is always great. Not our forte by any means. So that's always helpful.
Yeah, I think it just took a minute to flow in, as you know, when I pulled up the office visit now, it's all that data is in there. So I think it just took a minute or two for it to actually flow into the EHR.
Yeah.
So
I always get a little delay when you're in WebEx too.
Asking about the security measures of the patient links. All of the patient links that we're sending out for virtual visit are completely HIPAA compliant. They're 256 bits secured, and they're completely individualized to each and every single patient and guest that is invited to the virtual visit. And these links were built with healthcare in mind. So.
Yeah, and just to add to that, practices have the ability to set an expiration time. So like I mentioned with the group visit, each visit link for the patient and guest is unique. It's a unique URL. and the practice can determine when they want that to expire. So if someone missed their visit, they don't want them to, they're not going to jump into, there's no Zoom bombing happening. Let's just say that, right? So you can set some expiration on those, and they are all unique. One
You
other
also
thing
can
to
set a limit
add.
to how early the patient can join the virtual visit. So if you don't want them joining the virtual visit waiting room prior to 15 minutes before, then we can set that so that way, if they were to click on that link, they would have to wait until 15 minutes prior to the appointment in order to begin joining that virtual visit.
Mhm. One thing I do want to clarify is that we are not recording the video of this visit. There is no recording of the live synchronous audio video component. We capture the chat transcript, which is not what's vocally said. That is what's typed into the chat transcript. And then we push a virtual visit summary, which includes the intake information that you've captured. Outside of that, we're capturing when the patient joined, when the provider joined, how long they're in the virtual visit for billing purposes. And that lives within EHR. So I see another question from Carol asking a little bit more about instant medical history. Carol, I would encourage you to reach out to your account executive. They can get you a demonstration with our partners from Instant Medical History, and they can share with you all the ways that that can support clinical data intake. Virtual visits is one piece of that. There are two different options when it comes to instant medical history. One is kind of the basics. That's about 75 different clinical forms. 50 of those are offered in Spanish. There's also an opportunity to do some customization. So that's partner could talk you through what that would look like as well. I don't think I'm seeing any other questions coming in, Kevin.
I think we answered all of them as well from what I've seen.
One other question about the IMH functionality still working for a group visit. Yes, because that's a unique individual patient experience. It would just have to be the same IMH form that's presented to the patient for that intake, because that is configured to the event type that you're scheduling. So if a patient is part of a group visit, how will this be reflected on the patient history screen? It will be an encounter. It will be part of a group encounter, and you'll be able to access those templates to document the same way that you would. I think if I'm referring to the patient history screen the same way as I know it. So just like an in-office group visit, it would function the same way. It's just a little bit more automated because it is virtual. So it's going to automatically create that group encounter for that patient within that patient chart at the time that they check into that virtual visit. Great. One other call out that I have for you is we are offering an Empower Hour on virtual visits. How to optimize your patient experience through virtual visits will be some of the similar information that you saw here today. But if you would like to encourage staff or you'd like to join us yourself, we have that next week on April the 14th. I'm not exactly sure the time. I don't want to tell you the wrong time because I'm in Mountain Time Zone. So check out communications, look for Empower Hour, join us for that, how to optimize your patient experience. We also appreciate your time today. Thank you, Kevin. Appreciate you.
Absolutely. Thanks, everyone.
Thank you.
If you have any follow-up questions, just reach out to your AE. We look forward to speaking with you more in depth.